Hello, my name is Ashley Kelly. Today I'm going to share my dissertation proposal. My study is Employee Engagement and Leadership Collaboration, a gap analysis of unit-based teams. Most seek medical services to find health or healing. But what if I told you that you may actually not leave the doctor's office at all? I'm going to share with you a story about a woman who suffered from chronic back pain for pretty much her whole life. Her physicians tried treatment such as injections of steroids and even recommended surgery at one point. It seemed like the only thing that would help this woman was opioids. She continued on the opioids for about 10 years when she started to become concerned about her health. She called her physician and asked if she should be worried about liver disease or if maybe she was becoming addicted as she was increasing the amount that she was taking pretty exponentially. The physician calmed her fears and tried other things, but nothing quite seemed to work, and she kept coming back to the opioids until she was at a point to where she was coming up with stories and calling her doctor to refill her prescription early. For a number of years, she was being prescribed her prescriptions 2 weeks early consistently. On a dosage that was already twice the normal dosage, now she was doubling that. Until one day the physician caught on and realized that she'd been overprescribing these opioids to this patient for a number of years without even realizing. She decided to cut the patient off from any further opioids. About 3 weeks later, that woman was found dead in her bed. She died from withdrawals. The physician cut off the opioids without any sort of medical observation, and the woman passed away. Johns Hopkins recently did a study that said 250,000 Americans die each year from medical errors. What makes that worse is healthcare costs continue to rise, so we're paying more for care that could actually even be costing us our lives. Many healthcare systems are looking to implement performance improvement methods to try to prevent some of these serious medical errors just by looking at their processes and how they're making decisions. For this physician, if she had a process to alert her for a early refill of a prescription on a second request or even a third request, she could have caught early on that she was starting to enable this patient's addiction to the treatment that she had originally prescribed. But none of those methods actually were in place. These lean methodology systems that are being implemented into healthcare have to be supported by leadership. They have to be evaluated constantly, and they have to be put in place in every single level within the healthcare industry. It simply doesn't seem fair that someone who would go to a doctor to receive care would actually lose their lives. That 51-year-old woman actually happened to be my mother, and it's something that has hit pretty close to home for me. And I've taken it on as a mission to try to be a part of the change for the good so that these processes don't cost the lives of other mothers or grandmothers or children. There is an obvious need for change in healthcare today. This study aims to begin the journey of change through the evaluation of one of the most prominent healthcare organizations in the industry. The study will focus on a performance improvement program within that organization known as unit-based teams, or UBTs. The organizational goal is to have 85% of all UBTs rated at a level 4 or 5. Currently, the organization is meeting that goal. However, the departments are not actually achieving any of the targets set for the goals required to make their bonus each year. These key initiatives are the drivers for overall performance in the organization and include quality, service, and affordability. Just imagine being evaluated in your own industry for your performance using purely process-oriented measures, such as, did you complete your training? Did you come to work? Did you meet with a colleague? Let's say you achieve a perfect score, as most usually meet these basic requirements. Now imagine your bonus at the end of the year has nothing to do with this original process-oriented performance rating at all, but is actually based on true performance, such as meeting your department's financial goals or reducing your error rates. This is exactly what is occurring in this prominent healthcare organization. These UBTs are being recognized for completing process steps, but there is little to no improvement in their quality, service, or affordability. This problem is important to address because quality in healthcare is directly translated to saving and preserving human lives. Medical errors in the United States is now the third leading cause of death. Healthcare costs continue to rise despite several reforms to contain costs. This increased cost limits access to populations in the middle to lower socioeconomic demographics. Improving performance within the healthcare organization will directly impact the quality and affordability of the care the communities receive, including the reduction of medical errors. The mission of the organization in this study highlights an emphasis on quality, affordability, and service. The organization demonstrates a sincere interest to the health of its surrounding communities, even to those members that are not patients within the organization. Just this year, the organization invested millions of dollars to improve the housing in poverty-dense locations within Northern California. Unit-based teams are a group of frontline employees, managers, and physicians in a natural work setting who will, through consensus, be accountable for the performance of the unit and will determine the methods and metrics of the outcome. The team should be aligned with the region's business strategy and desired outcomes related to improved performance, service, quality, efficiency, and growth, and drive towards these outcomes with some level of consistency and standardization. This is the tool used to assess the performance of each UBT, known as the path to performance. If this looks like cognitive overload, well, that's because it is. There are 5 levels a team can aspire to, level 5 being the highest rated, where teams are identified as high performing. Levels 1 through 3 are assessed every quarter using this tool, and levels 4 and 5 once per year. The team is assessed by 7 categories: sponsorship, leadership, training, team process, team member engagement, use of tools, and goals and performance. Most of the items in this checklist are vague and/or highly subjective. For example, to be a level 5 UBT under goals and performance, the requirements are: team is achieving targets and sustaining performance on multiple measures, and team demonstrates a culture of health and safety. This study will use Clark and Estes' gap analysis framework, which evaluates knowledge, motivation, and organizational gaps related to this problem of practice. Unit-based teams were created to enhance the performance of an affluent healthcare organization by leveraging the power of frontline engagement. Evidence highlights employee engagement and autonomy in defining performance measures and goals leads to higher performance results. The program itself is supported by literature. The process and tools the program has adopted will be evaluated for improvement. For example, as mentioned, the current path to performance appraises teams based purely on measuring task completion, which has resulted in variability in actual team performance. Aligning the department performance in the appraisal process of teams will more accurately reflect the performance of the teams. Please take a moment to review the research questions. The entire population of approximately 2,500 enrolled UBT members will be surveyed. The population will be stratified by their roles, which are comprised of labor co-leads, management co-leads, health and safety champions, management sponsors, and labor sponsors. Data collection for document analysis will occur during the same time period as the survey. The study will be conducted using a quantitative approach, using a mixture of survey and document analysis. Historical data from employee satisfaction surveys, customer service scores, attendance rates, and injury rates will be gathered and compared to UBT performance ratings over the course of the last 2 years. The organization's IRB has already approved the study. Following USC's IRB approval, a survey with 30 closed-ended questions will be administered electronically in the months of August and September. The survey will be delivered via email using an online survey tool. It will also be made available electronically at employee-only events in the medical center. Key organizational initiative reports for 3 top performing, 3 middle performing, and 3 lower performing departments, according to their UBT performance ratings, will be reviewed over the course of a 2-year period. The teams that fall under these performance categories will be contacted via email and asked if they would like to participate by providing the performance documents for their department. The first 3 in each group to respond will be evaluated. Survey data and data retrieved from document analysis will be evaluated using descriptive statistics such as mean, median, mode, and standard deviation. All of the data will be evaluated for knowledge, motivation, and organizational influences to the problem of practice. The timeline for this study is to complete the IRB application process through USC by August, begin collecting data in August-September, and begin analyzing the data in October-November. Thank you for taking the time to review my dissertation proposal today.